I'm going to go back to the augmentation. So there's different things how to augment the rotator cuff. There's some interesting studies that may or may not augmentation will help. Typically, if we do an augmentation with allograft, which is some tissue that's not yours, we can do an augmentation of a acellular skin graft. There's a bunch of different ones out there. The Right Medical, it's called Graft Jacket, but there's a bunch of them out there, and it says a certain thickness. And so if you reinforce, if you have really thin rotator cuff and you put augment on top of it, if it's a really big tear, it looks like in the studies, the most recent studies, it looks like it actually will probably help maintain that and not have a re-tear. If you have a small tear, it may or may not be important. So, and most of us wouldn't use an augmentation on a small tear. Now, except for there's one from, it's called Regeniten, and that seems to have an interesting concept. If you have a partial thickness tear, you don't actually have to repair the rotator cuff. You just put the Regeniten graft on top of it to reinforce it. As far as the Regeniten, you don't have to take down the partial thickness tear. You can put it on top, and that shows some pretty good information, pretty good studies there that think it helps. Does a graft cause tightness in the stretching process post-op? No, the graft is not the reason for the tightness. The reason for tightness is them having to need to use the graft in general because they had to use the graft because it was so big, right? And so not because of the graft, but because of why they needed to use the graft. Full thickness tear with retraction. So full thickness tear. So we're all the way through. Retraction means it's all the way back to here, right? All the way back to here. With retraction, it's retracted back from where it's supposed to be. Okay, so then we have to bring it back over. And if it's been retracted for a long time, sometimes we can't pull it all the way back over. And if we can't pull it all the way back over, we have to do different things. And depending on who you are, how old you are, your activity level, how long the rotator cuff tear has been there, would determine what do we do. So it's a maybe we can get it all the way back, right? Maybe we can get all the way back, but not quite all the way back, just to the this we call the medial side. Then we would reinforce it perhaps with a graft. If we can't get it in close, we can do a partial thickness graft. And then, and then if we can't do any of those, then we can do a shoulder replacement. It has to be reverse shoulder replacement because the reverse actually replaces both the ball and socket joint, which we have to do, and then the rotator cuff. So that if you just do a regular replacement, we have to have a rotator cuff that's function. If we do a reverse, we don't have to. Reverse is actually a big surgery, right? We're burning bridges. We can't undo that. And so that's a problem. And so we don't like to do a reverse on anyone who's young. We like to try and fix it. And if we're getting older, oftentimes that rotator cuff gets more and more brittle. And even if we fix it, it's almost like paper and it can re-tear. And so that's why oftentimes in older people, we're going to be more likely to do a reverse shoulder replacement than try to repair it, even with a graft on top of it. So I hope that helps with the retracted rotator cuff tear. So any other questions? Okay, so the biggest thing we have to go by, and this I have to say this because well, I don't want to get sued, right? I am a doctor, but I'm not your doctor. Your doctor knows what's best for you, hopefully. If you don't think your doctor knows what's best for you, then you need to get another doctor. Okay, hydration during recovery. Yeah, drink as much as you can. Hydration and nutrition is important. So that's super important. Hydration, one, because we don't want to get constipated. And nutrition, because we want to bring all those things, all those good nutrition, micro and macro into your system so you can heal. So yes. So Mark, thank you for asking the question again. I think you asked this already and I didn't have a chance to answer it. It depends, but let's just talk in general. If someone comes to my, if your doctor doesn't know what's best for you, you need to see another doctor. If you're worried about the doctor, you're worried that they aren't really taking you seriously, they're not listening to you, then go see another doctor. I have another video on YouTube of how to select a right shoulder surgeon. You do not have to pick from a good quality surgeon, a good quality person, and a good technician, right? So the surgeon, physician, person, technician, which means doing the surgery, you should not have to pick. There are people out there who care about you, who will listen to you, and who will do a good job on your surgery. Not everybody's that, but they're out there. So if you are not sure of your surgeon, then I would go see someone else. We went back to inflammation. So if someone comes in, they have an irritated shoulder, x-rays look okay, and the exam is consistent with the rotator cuff irritation, so it's sore, but it's not profoundly weak, then typically what I would do is an injection, yes. I am pro-injection. Again, not everybody who's on this Facebook Live, not everybody who's on the Facebook channel is, not everybody is actually pro-injection. I think a lot of people have good reasons, although I don't necessarily agree with the reasons. I think that lots of people have some good reasons why they won't have an injection. It's not a panacea. Yeah, Lynn, that's a big tear, and you know, I hope that your surgeon has a plan, a complete plan. Like for me, if I had a supra and supraspinatus, infraspinatus, full thickness retracted tendon, I would have a plan, and we would discuss that plan before your surgery. I would have a plan if someone had that. What do we do if we can't repair it, right? Do we use a graft? Do we do this other thing called a super capsule reconstruction? And there's a video on that in the YouTube channel. We should be prepared to take care of whatever is going on when we get there. We should not have to sacrifice, say, oh, I couldn't fix it, so I just cleaned it up, right? Sometimes you can do a partial repair, so you can't repair all of it, but you repair some of it, and that can improve pain and function as well. So that's a tough one, Lynn. But again, you got to have confidence in your surgeon. You got to let them help you make the decisions, and you got to be comfortable. You got to feel comfortable that they know that they're talking about, and they know that you feel that they're going to take care of you. Second opinion doc. Okay, so that's a good sign. And for me personally, I'm going to say this, and then we'll get off for tonight. Personally, if one of my patients doesn't feel comfortable with me, and they say, "Hey, what do you think about a second opinion?" Second opinion, yeah. If you're thinking about a second opinion, get a second opinion, because the last thing I want is that you be worrying and questioning and wondering if I did a good job for you, if I really cared about you, or I did the right thing. So if someone has a concern like that, I would much rather them go see another doctor, because two things are going to happen. One, they're going to say, okay, you know what, this other guy's better. I trust him more. He's more like me. I'm going to go with him. And that's fine, because that's better for you as a patient. Or two, they're going to say, oh, yeah, that's what Dr. Orchid said, and I'm going to come back. And so either way, it's a good thing. How long should be in sling after full thickness full tear retachment? Depends on how big your tear was. Depends on how hard it was to fix. So it's really hard to say. It can be as short as 2 weeks. It can be as long as 8 weeks, in my opinion, for me. But again, it has a lot to do with what actually was done. There's doctors who do shoulders, and there's doctors who do revision shoulders. And you want a doctor who does revision shoulders, because they won't be scared or afraid to listen, to look at you, to examine you, to get another MRI and make a plan for you. So that's what I would say. You need to see someone who that you're comfortable with and you have confidence in. Cysts, what kind of cysts? Cysts are not common after shoulder surgery. I'm not sure what kind of cysts you mean. So Jill, tell me what kind of cyst you're talking about. Is there certain cysts they called it? Because no, we can have paralabral cysts where cysts are round. You could have a cyst around a stitch. You could have a cyst in the labrum, but usually we see that before surgery, not after surgery. So I'm not sure. If you can find out what kind of cyst and put it in the Facebook group, then I might be able to give you a more complete answer, more appropriate answer. So thank you so much. Remember, I'm not your doctor. This is not medical advice. If you need medical advice, you got to go see someone who can look at you, talk to you in person, look at your MRI, look at your x-rays, and I don't know, care about you, I guess. All right. Thanks, and keep up the good work. Keep on telling me. I appreciate that, and we'll see you soon.